Hello, friends. I am recording a voiceover PowerPoint, but I'm going to do it via Zoom. That's how I'm doing this in order to share my screen with you and show you a bunch of different things as we wrap up the US healthcare system. So let me go to my PowerPoint as I share my screen. And this is where we left off, actually the screen before. So we had left off with talking about the uninsured and where can they go and who's left most vulnerable. And now I just want to finish the PowerPoint up quickly. Oops, that's not what I meant to press. Quickly here. And what I want to let you know is that I posted the PowerPoint, the revised version today in module 4, and that's where this link will be as well. And I cut out a lot of stuff because, as I mentioned, we're turning this class into COVID class. So I just briefly want to go over some main concepts, and then I've kind of beefed up the readings. There are some videos and some websites and some articles. I'll go over that in a minute. But that is what I want you to be doing. My goal for the rest of the semester is that you learn basic concepts of public health. I want you to get the same content as far as a framework, and then I want to directly apply that to COVID because this is just the best learning opportunity out there. So what I do want you to know really quickly as we go over these last few slides, I want you to be aware of another program. We had talked about Medicaid and Medicare. An additional one is called CHIP. So it is basically a health insurance program that's partially subsidized by the state and by the federal government. So the federal government matches whatever the state pays for. The federal government matches that. And it's to offer health insurance for kids who are with parents who maybe make a little too much money to qualify for Medicaid. In our state, that's Medi-Cal, but yet maybe the parents don't have employer-sponsored health insurance for the family, and maybe they can't afford to buy their own health insurance plan or to buy into our state health insurance exchange, and those things were set up after the Affordable Care Act. And so this is basically a catching opportunity to make sure that all kids in our country have some sort of health insurance. So it's called CHIP. It started in 1997, used to be called Healthy Families. Now it's like a branch of Medi-Cal, but the eligibility obviously is different. You still do pay a monthly premium based on your income. There's a fact sheet that I have linked at the bottom if you want to learn a little bit more about it. This is a phenomenal resource that we have available. I have friends who have used this who make too much money from Medi-Cal, but don't get employer-sponsored health insurance, and at least this is an affordable way to cover their kids. Unfortunately, this is different than Medicaid and Medicare, and it has to be periodically reauthorized by Congress. And in the beginning of 2018, it was reauthorized, but after much hoopla where our president had threatened taking it away, and finally Congress did reauthorize it in January of 2018 for 6 more years, but it only gets authorized for short chunks, and we really have to fight to keep this program going. So we've talked a lot about the federal government. Briefly, I'm going to touch on local governments, and then I'll show you the readings that I want you to do to see how local governments are dealing with COVID. So our state health department, we're hearing a lot from our governor, who's linked to our state health department, talking about how we are preparing and responding to disasters, such as COVID. Other disasters would be fires, earthquakes, if there was ever a mass terrorism, bioterrorism, anything like that. They finance our major programs, just like we mentioned earlier, Medi-Cal. They run a state newborn screening program. So if you've ever been in the NICU or L&D and you've had to do newborn screening where you poke the baby's heel and have to put a bunch of blood on, like, I think it's now 6 different circles on a page, and you have to send it to the state lab, and it's just a kind of a laborious process, but it's a phenomenal state program that's mandated for all newborns, and we're able to find lots and lots of genetic syndromes that we wouldn't otherwise find right away, and then can provide immediate intervention. There's mandates on how quickly those blood tests have to get to the state lab and how quickly the lab has to analyze those and then respond to the newborn's pediatrician. And I want to say the whole thing is supposed to be no more than a 72-hour turnaround, so that we're able to offer pretty immediate intervention when we find a serious genetic syndrome. So it's a wonderful service that we have. Blood lead tracking is another service that our guest speaker from the immunization program in the county talked about. but that's a way that we're able to, again, mandate that all children, before entering either a state-funded preschool program or entering kindergarten, have their blood levels checked for lead, because this is something that can be very serious and ultimately fatal for children if they have a high amount of lead in their blood. And we can intervene and stop that worsening, which can lead to a lot of neurological deficits, and could lead to death. But we can also talk to parents about prevention and making sure that they can get lead things out of the house. And then, of course, the state responds to local agencies as appropriate. So when we had our Hep A epidemic here, the state was able to provide us with extra financial resources, which for us meant that that gave us the money to hire a lot of registry nurses to help with our Hep A efforts in immunizing all of the at-risk population, so mainly homeless people and IV drug users. And then, last but not least, the BRN is part of our state health department, making sure that we are assuring a competent workforce, one of the 10 essential services of public health, and that you all are competent as you go to care for our populations. Local health departments do a whole lot of things, obviously manage local epidemics. Fires is a big thing that we do as disaster response. They are the ones who stay on top of making sure that all schools are compliant with only allowing vaccinated children into them unless they have a medical exemption. There's websites there. I'm not really, you can look at that if you want, but I will show you some more that I want you to look at related to COVID in a minute. The other thing I just want you to be aware of, I had all kinds of stuff in this PowerPoint about the Affordable Care Act, and I just took it all out because I want you to focus on COVID, and also because the Affordable Care Act has changed so much since it was officially implemented in 2010. And what I do want you to know about healthcare reform is there's a lot of talk right now about Medicare for all. And so this is a phenomenal graphic that explains that. So essentially, Medicare for all is something that's been touted by mostly the Democrats, but not all. Joe Biden is not necessarily a fan of this. He wants some sort of public option, but hasn't been quite clear about what that is. But Medicare for all is basically saying we want the same sort of setup as Medicare, but we want it for everybody. So the way it currently works in our healthcare system is the top part of this graph, where we have patients. They pay premiums to insurance companies who then help pay for treatment to the providers. You pay a copay and insurance companies pay the rest. So we have a middleman, and that is the insurance companies. The way that it would work if we go towards a Medicare for all system is that we just get rid of insurance companies. So this is the most extreme version of that, and that we just pay taxes, which obviously would be increased overall. And then the government would pay the providers to offer services, which is how Medicare is run currently. There are some premium associated with different plans of Medicare, but essentially you pay into this with your taxes, small premiums, and then the government is kind of your health insurance and pays your providers, pays the doctors, pays the hospitals, et cetera, for your care. If you're interested, I'll just pull this up quickly. And I think this is something you should be interested in as we get to elections. This is where current 2020 Democrats stand on healthcare. Now, it's funny, about a month ago, I clicked on this website. They do update it frequently, and there were like 20 different candidates with their different responses. Now we're down to 3. And as you might imagine, our Republican candidate, President Trump, is definitely not a fan of Medicare for all. But if you'd like to see kind of how it's parsed out between these 3 Democratic candidates, and there's just more details as to what it is and what different things could possibly be covered and where the candidates stand on that. So I'll let you peruse that as part of your preparation for this lecture. And then going back to questions that we asked at the beginning of this lecture a few weeks ago, I just want you to be very familiar with the different ways that healthcare is paid for. So either by the government via our taxes, by individuals, or by health insurance. How it's provided, usually by government or individual health providers or private businesses, and then who has access. And this just goes through, is everyone, well, not everyone, but a lot of people, or only those who are employed, or is it only those who pay into the system? And then the next slide is just looking at the following topic that we're going over, which is healthcare around the world. And so for that lecture, what I want you to do is there's a link posted to the PBS documentary. It's an hour long, but it's really, really good. It's a little bit old, but I'm telling you, it is really, really good. I love watching it every semester. Basically, a journalist goes around the world and looks at 5 peer countries, so 5 other first world countries, and analyzes their healthcare systems in comparison to us. And so as you're watching that video, I want you to again be thinking of who pays for healthcare in these countries, and who has access. I'm clicking on this, realizing I'm talking a slide ahead. This is comparing us to other countries. Oh, no, okay. I see what I'm doing now. I was getting a little confused for a second. So this is basically showing us the different options for how government is, or how healthcare is paid for and provided for. And so for the first example, it says that one option is that the government pays for and provides it. And that's with our VA, and the UK is the same way. So I show how each country falls in line there, and then how that compares to different aspects of our healthcare system. So again, this is just a guide for you. Now let me show you where I want you to go on Canvas. So if you go into Module 4, I have the revised PDF of this PowerPoint, and I'll have this link. And then I have some readings and videos here for the different topics. Originally, we didn't have readings for US healthcare system, but because I've shortened the PowerPoint, I want you to take a look at these 3 different things. So right here, the USA.gov, this is a fabulous website, which basically shows you how, you gotta scroll down slow, oh, you gotta press the plus here. So what is the federal government doing in response? And it's just really awesome, tons of links, but it basically shows you all the main federal agencies and what their role is in the response to this pandemic. So obviously you're probably very familiar. CDC is the main one studying the virus, providing us with education and updates. This talks specifically about what Medicare and Medi-Cal recipients need to worry about. Different things like, what was one I wanted to tell you about? The EPA, Environmental Protection Agency, shares with us what kind of disinfectants actually work to kill COVID. The FDA is working a lot with the medical industry to develop the vaccines, to develop new drugs, treat it. I'm going to show you a link for a really fabulous video on that in a second. And it just goes on and on and on. So I'd just like you to peruse this and be familiar with the many different ways that federal agencies are responding to the pandemic. Each agency has a role to play. Often it's in research, collaboration, or education to the public. If I go back to my PowerPoint, nope, not my PowerPoint, my Canvas. So that's one. The second one is a fabulous resource. This here is the county's website for COVID, and this is updated daily. It has our numbers and our mapping of positive cases. It tells you how to prepare. I hope that you are familiar at this point with the term social distancing and the other term flattening the curve. And if you're not, please get familiar with those things. I can also post resources if you're interested in that. Basics on what it is, how it spreads, what are the symptoms, different educational materials that are available, and then guidelines specifically for health professionals. I just want to say that I attended with many of you all from Quad 2, the phenomenal town hall meeting that was virtual last night with the county. And I was incredibly impressed with the leadership that our county physicians are taking with this. And I actually learned a lot from the chat on the side, where it was all the different healthcare professionals talking about their frustrations, their questions. Really helped me get a better understanding of where the county is at with this and what everyone's trying to figure out. So lots of great information there, and they really pointed us to this website to continue to learn more about the latest orders. It was mentioned that we may soon be receiving the order of sheltering in place, which many other parts of California have done, such as in the Bay Area. My family in Fresno County is sheltering in place. So prepare for that order if you're down here in San Diego. Hasn't come to Southern California yet, but that is just an additional measure to increase our social distance, to flatten the curve so that we don't overwhelm our hospitals with ICU needs and ventilator needs that we are not equipped for. So that is the ultimate goal, is slowing down the spread so that we don't overwhelm our healthcare systems. More on that to come. I have lots of resources to learn more about that as well. The final thing I want you to look at, this is ABC News video. It's a 7-minute video. It's fabulous. I'm not going to click on it because it'll probably start, but it is a fabulous video that interviews different labs that are working on working with an old drug, chloroquine or hydroxychloroquine. So you may be familiar with this drug. It's used for malaria. It's an old drug. And there's been a lot of talk that it could be something that would help treat and slow the severity of COVID or coronavirus. And so this is just a great video that talks about, basically this is the FDA branch, right? FDA is getting these labs to work on this and to try to find drugs that are already approved, already known safety, and adapt those for coronavirus. And so if you're not familiar with chloroquine, please get familiar with it. I do try to use some drugs in this course as I prepare you for NCLEX. And so I do want you to become familiar with the drug chloroquine if you're not already. Since we don't have a PowerPoint for healthcare around the world, I'll just briefly touch on these things as well. But here's the link to your video, the 1-hour documentary that I want you to watch. Your quiz is on that 1-hour documentary, and I will be posting that quiz with detailed instructions under the box for quiz number 7. It is a group quiz, so I do expect that you be collaborating behind the scenes, however that works best for you. And then 2 articles to go along with that documentary to help you with the quiz is basically looking at how countries have responded to the epidemic and what can we, or the pandemic, and what can we learn to do and what not to do. Health policy and ethics I have not updated yet, so don't worry about that. I'll follow up with that. So I hope that you are doing well and that you are staying safe and sane. And thanks for connecting with me if you have. I love hearing from you.